Whose blunder is this?
Well, we have a very complex system and obviously all of those involved with the NHS breast screening programme are very sorry this has happened. We've apologised to women and I can absolutely understand those reactions that you've described this morning. Clearly all of us who use this system, myself included, want it to function reliably and invite all those women 50 to 70 who are in our screening programme. The error that's caused this is quite a complex one, but it predominantly affects the 70 and 71-year-old women coming up to their 71st birthday, and it is a combination of glitches in the IT system and some variation in the way that regional offices invite women in for their screens.
Can you say, or do you know, if there were women in this age group who actually did contact perhaps their GP or medical professionals and said, hang on a moment, I'm supposed to have a screening, aren't I? I've been for these screenings every couple of years. What's happened to my last one? Because there might be a concern that they've been told, no, don't worry, you know, you'll be invited when it's necessary. So, do you know if women have alerted you to the problem?
So I wouldn't be alerted personally, and Public Health England wouldn't be, but obviously, as I said, the screening system, although the GP is the sender of the letter is issued through the breast screening office. Now, I'm absolutely sure if a woman has gone to their GP and said, my last screen was on a date which was more than 3 years previously, and they were in the 50 to 70 year age group, they would have been referred for a screen to their breast screening office. But that won't necessarily, if it's spread across the country, again, although it's a large number, many of these women are choosing perhaps not to come in at that time. If it's spread around all of our 79 screening offices, it may not be detected.
But the trouble, yes, because that's another problem with the accountability, isn't it? And
it's a very
if women have said, you know, I haven't received this letter and I would like the screen. Then they would have had one. Yes, but at what point over 10 years did nobody say, hang on a moment?
You're absolutely right.
We're getting hundreds of women saying this.
Yes, so I think, and the first thing is, if we haven't had significant reports of that happening, obviously if we had, we would have acted on it and we would have looked. The reason that we've identified the glitch is actually because Public Health England inherited the control of the screening programme, and we have been putting in improvements to that, and it was the improvement that allowed us to see the age of the women centrally and find this problem. I mean, obviously it's our responsibility to identify that and to inform people, and that's what we've done.